Developing now, health officials across the Carolinas are beginning to address concerns of the hantavirus spreading. This comes after the North Carolina Department of Health and Human Services announced a person believed to be exposed to the virus lives in the state. Our Caitlin Ashbaugh joins us live after speaking with health experts. Caitlin, what do we know right now?
Hey, Mark. Well, at this point, we know that more than a dozen of those passengers are located in Nebraska, where they're undergoing treatment and monitoring, including that person that resides in North Carolina. At this time, we are working to confirm if that person has been tested for the virus and whether they'll remain in Nebraska or return home for treatment.
Until we know more information, we can't really finalize those details, but we are in process of plans and communication on that coordination when it occurs.
At least one American aboard the HV Hondius and another person are being monitored at Emory Hospital in Atlanta. Days prior labeled as, quote, mildly positive by the U.S. Department of Health and Human Services.
Preliminary tests may have shown equivocal results, but there's no mildly positive.
A passenger from North Carolina remains at a high containment facility in Nebraska, alongside a handful of people believed to be exposed to Andes virus, the only type of hantavirus known to spread through human contact. Assessment and treatment is expected to continue for up to 42 days, with a wide range of potential symptom onset.
Anytime you have that many people together in that small of a space, you never know what can really happen, but I think that just basic precautions are what we'd recommend.
The last North Carolina case of hantavirus, Williams explains, was reported in 1995. With only sporadic cases across the southeast region and no outbreaks, public health officials feel little cause for concern.
We have heard mighty little from the CDC. There's no South Carolinian person in isolation right now. That's why they probably didn't give us any messages, but they haven't done anything to prepare us for this.
At the regional level.
Clemson University houses one of 13 funded centers across the country focused on tracking viruses with high pandemic potential through federal, state, and local partners. At this time, we're told it's highly unlikely this lands on their radar.
A lot of factors that increase the intersection of human and animal encounters. We need to be ready to respond and respond strategically, because if we don't respond at all, a pandemic can wipe through a population. If we respond with just a blanket.
Caitlin, a good breakdown there. I think what a lot of people want to know right now, is there any cause for concern, especially as we head into summer travel season?
Well, Mark, because it only spreads through close and very close contact and long-term contact, these public health officials say that they'd be very shocked and surprised to see a widespread exposure. And they also tell us, interestingly, this is different than something like COVID-19, where they know a lot about the disease going in, despite COVID-19 being something they knew little about before the outbreak started. At this point, we know that there's been no official interruption to travel time and routine travel from federal authorities. And at this time, we also note that the state public health officials here in South Carolina have not issued any precautions. Reporting in Greenville, Caitlin Ashbaugh, WYFF News 4.